Lakesha Brown was in her early 40s when she was diagnosed with heart failure. A mother of four, she needed a life-saving option. She became her own self-advocate, seeing several doctors to find just the right treatment. And we are fortunate today to have Lakesha joining us live with Dr. Phillip Adamson. He's the Chief Medical Officer of Abbott's Heart Failure Division. They're going to tell us the rest of her story and more. Guys, thank you so much for being here, first of all.
Thank you for having us.
Thank you, Lisa.
Now, Lakesha, what symptoms did you have that made you go to the doctor in the first place?
Yes, it is very serious. It started with the shortness of breath for me. It was extremely uncomfortable for me to lay down at night. And I went into the urgent care clinic. They referred me to the first cardiologist that I saw. I had seen a total of 3, but there was no treatment plan with any of them, or they didn't tell me the severity of my situation.
Dr. Adamson, please explain what heart failure is, and is there any way to avoid it?
Heart failure happens when the heart's unable to pump blood to meet the body's needs. And that produces symptoms that many times people confuse with other problems, like shortness of breath. And like Lakesha said, many times this disease can get worse. In fact, Lisa, it's important to understand that heart failure kills more people over the age of 65 than cancer does. So heart failure produces symptoms that sometimes are hard to recognize, and the disease goes undiagnosed or misdiagnosed. Fortunately, there are a lot of interventions that we can do, including medications and other things, but the most important thing is to be your own advocate and to understand when seeking the right medical care is important.
And doctor, tell us about the treatment options for heart failure and the one that Lakesha actually received.
Well, time is of the essence, and it's important to understand that medications can be very effective to help this disease and to keep it from getting worse. But most of the time, the disease gets worse, even with the right medications. And when the disease gets to the point that people are having shortness of breath at rest and having difficulties like Lakesha described, it's very important to understand that that stage of heart failure can be treated with transplant. Unfortunately, there's not a lot of hearts to go around. And certainly a very important intervention is Abbott's HeartMate 3 device, which is an assist pump that's permanently implanted inside the heart that essentially pumps blood with the heart out to the body. That intervention can certainly restore life outside the hospital, prolong life, and improve the quality of life that patients have.
Lakesha, how did you feel after the device was implanted, and how are you feeling now?
After receiving the Abbott HeartMate 3, I could tell I saw the difference almost instantaneously. I was able to breathe on my own without having difficulties. I wasn't uncomfortable sleeping at night. And since then, I've been able to return to the normal things that I was doing prior to all this happening. So I'm just grateful.
Dr. Adamson, what do you wish more people understood about heart failure, and how can it be treated?
Lisa, I wish people would really become their own advocates and to understand that there are treatments available for this disease, because many people think of it as hopeless. The hope for heart failure is so important, and being aware of information. For example, there's a website called domoreforheartfailure.com in which patients can get more information about heart failure and direct their care and make sure they receive the best interventions to prolong and improve their lives.
And doctor, where do we need to go to find out more information?
Do More for Heart Failure, all one word, domoreforheartfailure.com.
Guys, thank you so much for being with us today. We really appreciate it.
Thank you, Lisa.